Hello, my name is Sylvia Ofori. I am a third-year doctoral student of epidemiology, and I'll be sharing my work on differences in prostate cancer outcomes by insurance status of African American males aged 65 years or younger in Georgia. Georgia has a higher incidence rate of prostate cancer compared to other states. And if you compare the incidence rate with the national average of 179.2 per 100,000, Georgia's value is still higher. And factors that are commonly associated with the higher prevalence is due to lack of education and inadequate health insurance coverage. Overall, about 19% of African American cancer patients below 65 years are uninsured. In this project, we aim to examine the disparities in prostate cancer outcomes by insurance status in this population. Data for this study was obtained from the Surveillance, Epidemiology and End Results Program, SEER, and the population of interest were patients diagnosed with malignant prostate cancer based on primary site. And to be eligible for inclusion, participants must be African American males between 18 and 65 years, diagnosed of prostate cancer between 2007 to 2016, and be Georgia residents. Those with unknown insurance status and unknown cancer stages were excluded from the study. And analysis for this study was done using Stata. And aside the basic descriptives, we did multivariate logistic regression and Cox proportional hazards to estimate adjusted odds ratio and adjusted hazards ratios. The main outcomes for this study were stage at diagnosis, cancer-specific mortality, and all-cause mortality. And for our independent variable, we looked at insurance status, which was categorized as uninsured, privately insured, or Medicaid insured. And other covariates were adjusted as well. So in our results, we had 6,671 participants, and about 85% of them were privately insured. And looking at the table, we can see that aside age, the other variables differed by insurance status. Before the multivariate logistic regression, at the univariate level, we can see that aside median household income and high school education at the county level, that is the percent of the population 25 years above without high school education. Those two were not independently associated with the odds of presenting with advanced prostate cancer. And the multivariate level two, we can see from the table that the odds of presenting with advanced prostate cancer was significantly higher in the uninsured compared to privately insured. So before the Cox proportional hazards models, we compared the survivability of participants using Kaplan-Meier estimates. So from looking at the comparison of Kaplan-Meier estimates for all-cause mortality by insurance type, we can see that at any time during the study, the participants who had Medicaid insurance had the worst survival outcomes. We present here the results for cost proportional hazard analysis. And at the univariate level, we can also see that still the We can also see that the county level variables were not independently associated with the risk of dying from prostate cancer. And at the multivariate level too, we could see that participants who were uninsured had an increased risk of dying from prostate cancer compared to those who are privately insured. In conclusion, we said that the higher odds of presenting with advanced prostate cancer in the study population for the uninsured and privately insured is not really surprising looking at existing literature. However, there is a need that in the future research could explore the differences between privately insured and those on Medicaid. Also, the increased likelihood of advanced prostate cancer diagnosis was offset by better mortality outcomes for uninsured, but not for Medicaid insured patients. These are the references. Thank you.